Greetings, I am Dr. Karl Nath, the Editor-in-Chief of Mayo Clinic Proceedings, and I am pleased to welcome you to the multimedia summary for the journal's September 2024 issue. There are 3 articles that have been selected as our Editor's Choice or Highlights articles this month. Our Editor's Choice this month is a brief report entitled Total Laryngeal Transplant in the Setting of Active Laryngeal Malignancy. It is authored by Dr. David Lott and colleagues from Mayo Clinic in Arizona, Phoenix, Arizona. Lott et al. Describe a most remarkable surgical and medical advance involving the first laryngeal transplantation performed in a patient with active chondrosarcoma of the larynx. As noted by Lott et al., there are exceptionally few documented cases of laryngeal transplantation in the literature, the present case report being only the 3rd such report in the United States. As described, the patient previously underwent surgeries to resect the cancer and reconstructive procedures, leaving the patient with a non-functional larynx. The patient was severely compromised in speaking and required a tracheostomy. Swallowing was difficult and aspiration was prevented because of the existing severe laryngeal stenosis. On February 29, 2024, the patient underwent a team-based surgical procedure that involved transplantation of the larynx, pharynx, proximal esophagus, proximal trachea, thyroid gland, parathyroid glands, laryngeal nerves, and vasculature, from which the patient has made steady progress. Overall recovery is anticipated to require at least 1 year, in part because of the re-innovation of the transplanted structures and the acquisition of requisite laryngeal mechanics. It should be noted that the patient was already on immunosuppression because of a prior kidney transplant, thereby mitigating concerns that would have otherwise occurred with the introduction of immunosuppression in this setting. This therapeutic tour de force and this remarkable advance in this field, as described by Lott et al., are notable for the following reasons, among others. First, Lott and colleagues have steadfastly built and established a dedicated and recognized larynx and trachea transplantation program that integrates a comprehensive focus on the salient issues in this field, namely discovery science, relevant clinical expertise, evaluation of efficacy and patient safety, ethics, patient expectations, and the conduct of clinical trials. Second, the clinical component of this program is approved by the United Network of Organ Sharing. Third, this advance grew out of a requisite and unique milieu and a network of clinical expertise dedicated to laryngeal transplantation. Fourth, the management of the patient was performed under the auspices of a clinical trial with all the governance, security, and rigor that this approach entails. Successful transplantation of organs and tissues bestows a gift of life and/or affords significant improvement in the attendant quality of life. As regards the latter, Lott et al. At Mayo Clinic in Arizona are to be most warmly applauded for this seminal advance in patient care. Our first highlight this month is a review article entitled Review of Recent Literature and Updates in Non-Statin Cholesterol Management. It is authored by Dr. Elizabeth Wang from the College of Houston College of Pharmacy, Houston, Texas, and colleagues from the Michael E. DeBakey VA Medical Center, Houston, Texas, and the Denver Harbor Family Health Center, Vicino Health Centers, Houston, Texas. Introduced in the United States in 1987, statins are a foundational therapeutic approach in the primary and secondary prevention of atherosclerotic cardiovascular disease. However, in certain patients, despite maximum tolerable statin dosages, the reduction of low-density lipoprotein cholesterol may be suboptimal, thereby necessitating additional therapeutic approaches in meeting this objective. Additionally, statins may cause a number of debilitating side effects that limit their use. Along with these considerations, there have been two critical developments in this field in recent years. First, as clinical data and evidence have accrued, continual evolution and expert guidelines regarding the prevention of atherosclerotic cardiovascular disease has occurred. So much so that a perspective is needed to emphasize the most recent ones and to place such evolution in its proper context. Second, novel and effective therapies other than statins are now available in reducing LDL cholesterol. The present review of Wang et al. Addresses these two key developments in this field. The authors chart the evolution of guidelines beginning with the 2002 National Cholesterol Education Program Expert Panel and all the way to the 2023 AHA-ACC Chronic Coronary Disease Guideline. In so doing, Wang et al. Provide a helpful table that summarizes the key guideline information under the headings LDL cholesterol goal, primary prevention with or without diabetes, LDL cholesterol goal, secondary prevention, and LDL cholesterol goal, primary prevention and secondary hypercholesterolemia. The authors discuss novel therapies that include PCSK9 inhibitor monoclonal antibodies, inclisiran, and bempedoic acid, summarizing in the text and tabular form with an appealing figure the basis of their actions in reducing LDL cholesterol and relevant clinical studies pertaining to their efficacy and clinical outcomes. The authors conclude their review with a synthesis of key concepts in the pharmacological management of hypercholesterolemia, in which they also discuss therapeutic approaches other than statins and these novel therapies, patient factors and clinician factors in achieving treatment goals, therapeutic inertia, de-escalation of therapy, and shared decision-making. This timely review nicely distills current critical considerations in expert guidelines and novel therapies in this dynamic and important field. Our second highlight this month is an original article entitled Predicting Primary Care Physician Burnout from Electronic Health Record Use Measures. It is authored by Dr. Daniel Tawfik and colleagues from the Stanford University School of Medicine, Stanford, California, and colleagues from the Harvard Medical School, Boston, Massachusetts, and the Washington University School of Medicine in St. Louis, Missouri. The electronic health record is a prominent participant in patient care. A question that arises is whether the electronic health record may be used to predict physician burnout, a phenomenon often linked to the very ubiquity and use of the electronic health record in clinical practice. This is a timely question as burnout is characteristically assessed by surveys which may be subject to recognized limitations and weaknesses. In their retrospective longitudinal cohort study, Tawfik et al. Addressed this question in primary care physicians and their work units at an academic center. Routinely collected use measures of the electronic health record were employed to generate physician workload and efficiency scores, which were then related to previous burnout surveys. Predictive models for burnout were then developed. The data demonstrate that the primary prediction model for burnout achieved an area under the receiver operating characteristics curve of 0.59, with secondary models performing similarly. The performance of these models for predicting burnout was thus unimpressive. The most predictive features were physicians' age, team-based notes, and orders with use-defined preferences. When burnout was assessed at the work unit level rather than the physician level, these models performed somewhat more reliably. The authors discussed reasons for this underwhelming performance of the electronic health record in predicting burnout, especially in light of this apparent inconsistency with prior studies which have convincingly showed that burnout, as subjectively assessed, is linked to the use of the electronic health record. Thus, at the present time, the electronic health record, for all of its versatility and ever-rising capability, ironically, is not a reliable tool in predicting what the electronic record is often perceived as contributing to, namely physician burnout. The electronic health record shows more promise in assessing burnout at a clinic level. How collected data and applied analyses could be expanded and refined such that the electronic health record may be used to reliably predict burnout is a current challenge in this important research field. You can access these highlights and editor's choice articles free of charge during the entire month of September. Please visit our Mayo Clinic Proceedings website at www.mayoclinicproceedings.org, where you will find our online-only features and many news stories posted in the News from the Editor carousel on our website homepage based on articles published in Mayo Clinic Proceedings. You will see other free content as well as articles published online in press. You will also find links to our social media by clicking the links at the bottom of the homepage to follow us on Facebook, X, formerly known as Twitter, and YouTube. On our YouTube channel, you'll find full-length author interviews called Insights and our MCP 60 seconds video article synopses. Our website also includes our Mayo Clinic Proceedings issue summary and Author Insight podcast recordings, which are available from our website on the homepage, as well as through iTunes. As always, we greatly thank you for your interest in and support of Mayo Clinic Proceedings. We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com/Mayo-Proceedings, or journal updates on Facebook, www.facebook.com/Mayo-Clinic-Proceedings. You can also follow us on X, formerly known as Twitter, at www.twitter.com/Mayo-Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.